Discussing vascular ultrasounds is Heart Center Technical Director of Vascular, Edna Correale. Ms. Correale, what types of vascular ultrasounds does the Heart Center perform?
We perform several different types of vascular ultrasounds. Renal artery, carotid, aorta, and peripheral arterial studies.
Can you describe the different types of ultrasounds?
Well, the carotid ultrasound is the ultrasound of the carotid arteries, which are the main arteries that supply the blood to the brain. The renal arteries supply blood to the kidneys. The aorta ultrasound, the aorta extends from the heart and goes through the abdomen, and we look to see if there's any plaque or possibly even an aneurysm in the aorta. And then the arterial ultrasound is an ultrasound of the legs, and what we look for to see if there's any narrowing or if there's any buildup of plaque in those arteries that could be causing some problems with walking.
Are there any risks with ultrasound imaging?
Ultrasound imaging is all non-invasive. There are no risks. There's no complications. There's no needles, no dyes, no ionizing radiation. It can be repeated many times without any side effects.
I understand that you have to apply gel to the skin. Why is that?
Well, the gel, first of all, is a clear water-based gel. It's non-staining, and what it does is that it provides a secure contact for the transducer that is pressed against the skin. The technologist will press the transducer against the skin, and you may feel some mild pressure.
Do I have to fast before an ultrasound?
Well, if you're having a renal artery, aorta, or an arterial ultrasound, then you need to fast for 4 hours prior to the test. If you take medication, then you can take it with a little water. You can also bring something with you to eat once the test is completed. If you're having a carotid ultrasound, there's no preparation.
What is a carotid ultrasound and how long does it take?
Well, the carotid ultrasound takes about 30 minutes, and it looks at the main arteries on either side of the neck.
What about the aorta ultrasound?
The aorta ultrasound looks at the main artery that's in the abdomen, and it takes about 30 minutes.
And what about the renal artery ultrasound?
The renal arteries ultrasound looks at the renal arteries on both sides of the abdomen and also looks at the kidneys, and it takes about 60 minutes.
And finally, the peripheral arterial ultrasound.
The peripheral arterial ultrasound is an ultrasound of the arteries in the legs. It takes about 60 minutes, and we also apply blood pressure cuffs to the ankles and to the arms.
What is the purpose of these ultrasound tests?
These tests provide important information for your physician so that he can plan effective treatment that is best for you. The tests look at the degree of narrowing and the amount of plaque that is present in the arteries.